Welcome everybody to our North Texas Heart Spark Advocacy event. We're so happy that you carved some time out of your evening. We know your time's valuable and we really appreciate you spending it with us. With your presence today, we've chosen to link arms with the American Heart Association to become a relentless force for a world of longer, healthier lives. Our goal today is to learn more about the AHA's approach to improving heart and stroke policy and how to share your own story with elected officials. And so first on our agenda, I'm going to turn it over to my colleague, Douglas Dunn-Savage, to introduce our first special guest speaker. Douglas.
Hello all. My name is Douglas Dunn-Savage. I am the North Texas Community Advocacy Director, and I covered North Texas. I've been with the Heart Association about 18 years now. It's been a real honor. I'm just very excited about this event series. And I'm even more excited to kick this event series off in introducing State Representative Yvonne Davis. Yvonne Davis has been a mentor to me over the last 20 years in politics. I worked for Representative Davis for 2 sessions as her legislative director. I've learned so much from her. She currently serves as vice chair of the House Committee on Judiciary and Civil Jurisprudence. She's one of the senior members of the Texas House of Representatives. She's former chair of the Democratic Caucus and is past chair of the Texas Legislative Black Caucus. And I don't know if she is able to join right this very second, but I am texting. I know that she is got a line in.
Actually, I'm here.
Hello, Representative Davis. How are you?
How are you, Douglas?
I'm okay. And one of the things about working for Representative Davis, first of all, in terms of her teaching me so many things, it's some of the hardest work you'll ever do with some incredible gratification in terms of the efforts that she does for Texas every day and has been a public servant for her career. I would also, Representative Davis, if you could maybe talk a little bit about, one of the things that you sort of iterated to your staff throughout the years and the years that I worked for you is that you always need to listen to your constituents and listen to their stories and their voices, because that's who, first of all, keeps you in office, but also really sort of guides a lot of the decisions that you make in terms of your service to the state of Texas. So without further ado, Representative Davis, thank you again for joining us, and love that you made the time.
Sure. I'm glad I had a chance to do this. Sometimes I don't get to do this kind of stuff, and I appreciate the opportunity. Let me just say, first of all, public service is one of those things that I enjoy, because on any given day and most every day, we make a difference for somebody so that there will be a positive experience. I happen to believe, having worked at every level of government, I've worked for a council, for a mayor, for a county commissioner. I worked for members of Congress in Austin and Washington, and I worked in the Senate in Austin. So I pretty much been through every level of government. And one of the things that I've always believed and continue to believe is that government should be for people. It shouldn't be something that people look at as a burden. We should be trying to make sure as officials that it's accessible and available to improve the quality of life for the folks we represent, and encourage people to own their government. You've heard the phrase, if government is for and by the people. I believe that, because at the end of the day, that's what we're supposed to do. The services that we offer, the programs that we offer, the opportunities that we offer are all designed to improve the quality of life. And if we're not doing that, then we're missing the boat. So I tell folks to reiterate the point that Doug made earlier. we're constituent driven. Our basis for being here is to improve life for the constituents we represent and be a voice for them as issues are being discussed. And that never leaves the center focus of our efforts in Austin and in the community. We do an incredible amount of community constituent, what we call casework, constituent work, that originates with people having problems with either state agencies or problems that really need to be looked at in terms of filing legislation to fix something. And then the other part that we have to also spend a little time with is getting to know people in our districts. It should be that your government official understands what the values and principles are that guide the community, and the community needs to know their elected officials so that they know what their guiding principles and values are. If we do it right, they should link up and you should be working toward common goals. That is the most important thing that we can do in government, is continue to be a representative government. Sometimes it doesn't work because every time you have an interest on the right, there's an interest on the left, and the competing interests oftentimes can be in conflict. The balancing power is through the legislative or elected officials process, that we take the most we can from each side and make a product where everybody benefits equally and are harmed and are not harmed as much as possible, so that at the end of the day, you've done some good. I would just tell you lastly, the thing that I'm most worried about is we have gotten away from talking to each other. I tell all of my constituents, I still have local community meetings and town hall meetings. I still have an open door policy where you can call and set up a visit or walk by my office. If I'm there, I'll see you. We gotta continue to communicate with one another. This blind communication, I know everyone loves social media and Facebook, but it doesn't lend itself to building a relationship. So I encourage folks that if you're going to do that, that's fine, but also get to know your elected official personally so that they know who you are. And they get to know what your interests and values are versus just something they read about an event or a comment on something. You really need to get to know each other. So as I said, the most important thing is always going to be trying to make sure that you are providing representative government so that it in fact reflects what the district or what your community wants. I'm happy to answer questions. I don't know if there's particular things that I need to do.
Oh, Representatives, I have a quick question for you in terms of listening to your constituents. I know, every morning during session, before you go out to the floor, you have your staff preps you with the bills that are on the floor for the day, et cetera. But the thing at the front of your folder are all the constituents' requests via email or phone calls. You want to know about that as you start your day. Can you tell us sort of in terms of the advocates that some are just new to learning how to advocate and learning how to communicate with elected officials, but how important that has been to you in terms of your success over your term in the legislature to hear the voices of your constituents, and why you put that at such a focal point?
Well, I think the most important thing about representation is having that interaction with your constituents. So you know really what they want. We don't want to presuppose we know. The calendar, the legislature starts each day with a calendar of bills that are going to be considered. And it can be from healthcare to transportation to taxes to education. It can be about the dogs. It can be lots of different things. But what we want to do is make sure that we have an opportunity to hear from constituents. I get routinely emails or phone calls. I tell folks to take time to call your elected official and set up a meeting and go visit with them. So that they, I mean, we want to know, a good representative wants to know what you're thinking and what you're feeling about legislation, because we think we know, but if you tell us, we really know. So to be prepared for floor debate and discussions, the mail, the telephone calls, the interaction, the visits by the office will give us an indication of where people are aligning in terms of support or non-support for legislation. Obviously, sometimes legislation is not good, so we have to be prepared to be against bad legislation as much as we are for good legislation. So that continues to be a challenge. Legislation is balanced. The state is so diverse. The population is so diverse. When I first went to the legislature, they used to talk about urban Texas and rural Texas. We are so diverse, we really can't now. They've added suburban Texas. We really can't have issues that's so different from each areas that it ends up undermining different populations of the state. So we've attempted to try to treat the entire state the same as with the other parts of the state, so you don't have different policies across the state. You hate to be driving and all of a sudden you get into another area and the speed limit changed and you didn't know that, so you get pulled over. So we've tried to be consistent in our policies, but I will tell you there's some differences and nuances that just go with the territory. For example, in West Texas, they have a different culture of how they would do farming and how they do their roads, because it's very different than our roads and the way they're traveling in the city. So you have to balance off where those issues are different and look for ways to make it as uniform as possible, but recognizing there are some differences throughout the state.
That's fantastic. I would open the floor to any questions or thoughts, as we really do appreciate your time today, Representative Davis. And
No problem.
thank you so much for taking the time out to join our call.
Well, I'm anxious to hear from you guys, students and the members of your group, because sometimes we miss it. So tell me if I missed it. What do we need to know that we're missing from your age and your perspective?
Thank you, Representative Davis.
If anybody has any questions, feel free to come on camera and ask Rep. Davis your question.
So this means that y'all love me and you'll be voting for me and all that stuff. I'm the smartest person in the world. That's not what this means. I appreciate that.
Thank you, Representative Davis.
Thank you, Doug. I appreciate the opportunity to visit with you guys.
Okay, have a great evening.
All right, bye-bye.
All right, that was wonderful. I want to interject just a quick minute for your viewing pleasure. If you don't already know, you can adjust your viewing so that you can see the screen as well as the current speaker. So what you need to do is just look on the top right corner of your screen. It'll say view, and then it will say side-by-side view, and you can actually move the bar, whichever one you want to make bigger or smaller. So just wanted to give you all that little Zoom meeting trick. And then also I wanted to quickly address the meal voucher situation. We sincerely apologize. About an hour ago, Uber Eats business decided to suspend our account for some unknown reason. So some of you, like myself, might have had some success already ordering your meal. I had no problems, but I have heard from some of you already via email that you did have some problems and that it wasn't working correctly. So please know that we sincerely apologize for that. and that we are working quickly to try to make that right, and that we will give you, if we need to, another voucher that does not have a cutoff time period that you can use whenever you would like to. So sincere apologies. Sometimes things like that just are beyond our control. So thank you for understanding. And with that, we are going to go into a presentation with Douglas and Connie.
And Elizabeth, I don't know, I'm not seeing the slide. Oh, there we go. Perfect. So again, welcome everyone, and thank you so much for joining us this evening or this afternoon and into the evening. We just really appreciate your time, and we hope that the information that we're going to be sharing with you is beneficial, and that you will be prepared to go out and speak in front of Senate committee or in front of a press conference by the end of these events. So, but I wanted to give you all a little bit of background. I've been with the American Heart Association, as I mentioned before, for almost 20 years. I've been in numerous roles across the organization, working both at the local, state, and federal levels in terms of policies. And my most recent role is Director of Community Advocacy in North Texas. And it's my most passionate role that I've had, because I really think that politics is local in terms of really having impact. It's a tremendous opportunity to affect change, especially in these times. I think that, you know, with COVID and with the great transition that we've had over the past 2.5 years, it really has been about communities coming together all across regions and statewide. And I've been very blessed in working in public policy over these years with the American Heart Association. I've never, my mom always used to say that if you do what you love, then you love what you become. And over the 18 years, looking back at all the impact that we've had and the campaigns that we've accomplished, one of the first volunteers that I ever worked with when I first came to the association was Connie Kerr. And so Allison and Elizabeth sort of thought that it would be a good idea for us to sort of have a discussion about some of the experiences that we've had over the past years, with the intent of sort of giving you the different facets of policy campaigns, whether you're at the local level, working at the local level, whether you go down to Austin and advocate, or even if you go to DC, there's a lot of commonalities and things that stay the same. And I think the first thing, overarching thing, is for you to understand the voice that you're telling your story, and you're personalizing your story as you advocate for the American Heart Association, or even if you're advocating for yourself, to really understand your voice and to understand that elected officials are not sort of up on this pedestal in the sky. But and so next slide. So I don't know if everyone can see this, but I think we can, and please adjust your screen as necessary. But there are a lot of aspects of policy campaigns that stay the same across the board. And just as sort of an aside, the American Heart Association is a 501c3, which means that we do not give monies. We're not a 501c4. We do not have a PAC. We're a bipartisan association. But the way that we have had so much success over the years of us having an advocacy program, which really became sort of streamlined in about 2008, where we really started to focus and understand that through advocacy we can affect true change, is sorry, I got distracted there, excuse me. But that in terms of how we get these campaigns done, the bottom line is that we do it through volunteers telling their stories, and also through our science. And so hopeful that in terms of giving you this information, that we sort of give you that sort of baseline and infrastructure in terms of how we go about it without giving, you know, thousands and thousands of dollars to candidates, but really using our brand, our strength in volunteers and our science. So Connie Kerr. Connie and I, as I said, have been working together for 18 years, and Connie, why don't you start by telling us how you got involved in the AHA and why you got involved with the AHA and what made you sort of gravitate towards advocacy.
Good afternoon, everyone. My reason for becoming involved in American Heart Association has been a strong family history of heart disease and stroke. My maternal grandmother passed away when my mom was only 22 years old. I was 2. I don't really have any memory of her. And it wasn't until I was 22 years old that it sort of hit me that my mom lost her mom at that point in her life. And wow, what can we do to make sure that that doesn't happen to other, you know, people and parents and loved ones. So there's a lot that can be done with education and programming and that sort of thing through schools and health clinics and churches and all of that. But what I discovered just by dipping my toe a little bit in advocacy was that change can be dramatically affected by policy. You have an opportunity to reach a lot more people than I could, you know, going up and down my street, passing out literature. And so it was my niche, and I got bit by the bug, and I love it. I'm still doing it. So
absolutely. And you know, in terms of first learning about advocacy, maybe you could talk about demystifying of these elected officials. I know when we first started working together, we had a list of officials that in the region in North Texas that we literally drove around North Texas and went to the district offices. And at first you're like, are we really going to talk to the state senator or the state rep, and maybe share a little story about, or some experience in terms of that demystification, if you will, of elected officials. And because I know that some folks, if you're in the room with the mayor, it's a different than being in the room like us right now. But maybe talk a little bit about that.
Well, I think what has always struck me is, first of all, there's a great deal of power in the voting booth. And I'm a big advocate for you got to vote, or otherwise you have no say. Mm-hmm. And you better not complain if you didn't vote either. Right. So I feel real strongly about that. Those people are not in those offices unless they're elected to be there. The other part of it is they put their socks on one foot at a time, just like you and I do. Yeah. And they are regular people. The benefit of being an AHA advocacy volunteer is that wonderful staff like you and all the others will prepare the materials, will coach you, will make you comfortable with the information. And so you're not going in there blind, okay? The other part of it is that the elected officials know that anything that comes from the AHA is science-based, has been fully vetted, is legit, real information. And
real news.
And real news, the real deal, and they trust it. And you're speaking that information. And so there is a level of trust that comes from walking in the door under the banner of the American Heart Association. And that's a real rush, you know, that you feel like you're there to give them and share information with them that they want to receive.
Absolutely. I thought we sort of touched on this, but in terms of bipartisanship, you know, that's not to say that we go into these meetings always knowing that we're going to get that yes, or the support that we need to get it through committee, to get the legislation through committee, to get the policy through committee. But maybe talk a little bit about why the bipartisanship from AHA works. But then secondly, maybe share an experience in terms of when we knew we were going in to talk to somebody that was not on our side. So maybe expound a little bit on that.
You can't wear your own personal political flag at all. We're there to lobby and influence decisions on both sides of the aisle, and American Heart Association couldn't succeed if they didn't operate that way. Now, if you have a personal relationship with someone who is elected and they know how you are personally, it may be a little bit different story. But I didn't have that experience and with myself, and still was able to get through to the elected official. And again, I give the credit to AHA that the information that I was there to share was valid and trusted and important, or I wouldn't have been there.
That's a great point. And the other thing is, I know that, you know, I've sent you off and we've been at the Capitol and it's like, can you hit this office? There's a vote coming up, or I would send Connie to hit these two offices, right? And you get asked a question that you couldn't answer. So maybe expound on that a little bit.
You know, there's no such thing as being put on the spot like that. And it really is an opportunity, if you're asked a question that you don't know the answer for, that you go, well, I can't answer that right now, but I will find out the answer. Write it down, be sure and write it down. So you don't walk out of there and go, oh no, what did they ask? So write it down and then get their card. And that's one more opportunity for you to be back in front of them to get them that information that they wanted to know. And they will remember you even better.
So in terms of being empowered as an advocate for the American Heart Association, and you know, we have a seasoned advocate in Molly Nolan who's on the call, and she's, I think, going to speak at our next event series, but wanted to talk about, or maybe get you to share a little bit about how this has empowered you in terms of having that impact, and maybe an example of where you're like, wow, we did this, or was there a moment, or have there been moments over the years that sort of you're like, wow, this is.
Yes, absolutely. I think starting back even with the placement of AEDs in public places,
I remember
that was huge. And just to know that if someone went into an event, that equipment was close by. And with that placement, then came the educational element that had to be completed as well.
Implementation.
Yes, an implementation of it. You know, we were able to partner very closely with City of Arlington, you know, spoken Fort Worth for the at the county commissioners, for them to do the same. And that really touched me that we were able to make that happen. The other thing is anything related to smoking. I can walk into a restaurant in Arlington, I can walk into a bar in Arlington and not have to deal with secondhand smoke. I have asthma, so it's a big issue for me. So seeing changes like that are affecting, being able to sit down with a woman who owns a bar up on Division, who fought against us tooth and nail, and to be able to go into her bar after the fact, after the law is in place, and sit down across a Bloody Mary with her and discuss how her business has increased. And she fought us. She did not think it, she thought she would have to close her doors. So that's changed. It's right there.
Absolutely. So in terms of, I just want to make sure that sort of getting this across, and this is for everyone on the call, as sort of you're developing your story and learning more about the Heart Association and sort of how we go about furthering public policy, one of the main things is to really garner your own voice as it relates. So Connie has a different story than I do, and then Molly. You'll hear Molly's story at our next event, but you'll hear some phenomenal stories on this call tonight. That, and I think that, you know, we're the most impactful thing, just as a registered lobbyist in Texas and who's lobbied all over the country in state legislatures. The most impactful thing that we have at the American Heart Association are the stories of our survivors and our volunteers, because everyone has been touched by cardiovascular disease and stroke. You know, I've worked for the Heart Association for about 1.5 years, and I just left Yvonne Davis's office, and I get a call that my dad had a heart attack, and he was saved by a defibrillator and by a school teacher who knew CPR, and was shocked back to life because the defibrillator was there, or the EMTs came. They were trained, and that all has to do, this chain of survival, and we'll be talking about it more tonight, but this all has to do with sort of the impact that our research, our education, and sort of directly our advocacy has through the coalitions that we build, through that direct lobbying that we're talking about, touching the elected officials. In terms of grassroots, and we're going to get a lot more specifics from Allison later in the evening, but in terms of grassroots, is there something that stands out to you as, and on our slides, and we don't have to pull them up again, but it's a real facet of our campaigns in terms of our grassroots and our key contacts. And, you know, as you get involved in these campaigns, your networks are hugely important from a social media perspective, but also from a relationship perspective. And so maybe talk a little bit about some grassroots efforts and tactics and campaigns that you've experienced over the years.
The one that's foremost in my mind, because it's the most recent, is smoking regulations in Arlington. And we pulled out all the stops. You know, we went back to our old AHA volunteers in Arlington and recruited that group to be involved in this. I stay in touch with a lot of those people, you know, just as a personal thing. And so getting that group together, the Impact organization is a PAC in Arlington that only addresses local issues, city issues, not school board or anything like that. And so we got that group of women involved, and they came out in force, wearing T-shirts, going to the meetings, going up and speaking, the kind of things, making the calls afterwards, making the calls in advance, sending emails, all of the things that are a part of a grassroots campaign. They were right there side by side with us. And their presence was invaluable, and absolutely credit that element for passage of the ordinance.
That's fantastic. So we talk about, and maybe if you could go to the next slide. So this is the public policy continuum, and I'm not going to go through all of it, but I want to talk a little bit about, there are consistencies on this continuum that are true in every campaign that we run. So the first little notch, it should say campaign planning on top of that. And I'm sorry, that's my mistake in terms of a typo not being there. But before we undertake a campaign, we really look at a lot of different factors. So we look at the political climate. We look at the most recent electeds to the board or committee that we're working on. And we really start to target decision makers. First of all, we see if the campaign is even viable. I mean, you know, in a lot of places, the political climate just isn't there. for certain issues that we take on. That said, what we really try to do is come up with a list of targets that are going to give us what we want in terms of furthering the policy, getting that formal vote. And so we really look at our grassroots network, which you all are going to be a part of now, in terms of the relationships that you all have, but also using your voices to target, and targets are always people. So for instance, we're working in Dallas County right now, and we're targeting the county judge and the chair of Health and Human Services. Alec can talk a little bit about what goes on at the state level, but there are targets, and then we sort of do that policy analysis. Like, what is it going to do? How are we going to get to where we're going? So we look at the climate, we look at the people that we're targeting, and then we go through a policy analysis, which what needs to be changed at this local level, at this state level, to change the policy to make it work. And then we really sort of look at the campaign itself, so the implementation of the campaign. That's when we're really going in and touching those folks, the direct lobbying, the media advocacy, where we're using, sometimes press can be very, very impactful in terms of moving the needle on public policy, both on the legislative side and then the regulatory side, which are the state agencies that we work with. The other thing the last thing that I'll talk about in terms of this continuum and in terms of us working together, we've been incredibly successful in going in and getting these campaigns done, getting smoking ordinance done in over 100 cities in Texas, getting CPR required for graduation, defibrillators in all public schools, working on hypertension and nutrition security issues on the local level to really have that impact. What we've been really good at is going in, doing this continuum, getting these campaigns done, and then what we have done in the past is we sort of bounced out, and this is done here, so let's go on to the next. But what we've really realized in terms of having that impact is to really, when people think of public health, they should think of the Heart Association first. So really trying to become a part of the fabric of the community. And what that entails is not only passing the laws and the ordinances, but also working on that policy implementation. So ensuring that schools are training all their students before they graduate in CPR, making sure that the bars are really going smoke-free. So, and then that is sort of hand in hand with that evaluation portion to really start to see the impact that we're having. When smoking ordinances are passed in cities, there have been numerous studies that have shown that cardiovascular disease in emergency rooms, acute cardiovascular events decrease tremendously. So we know that it has that effect long term. We're really evaluating after these laws and policies have been passed. So please take a look at those slides more in depth. They're really, I think, great information in terms of things that happen in all of our campaigns. And I think that's sort of what we wanted to cover, but wanted to open it up for questions to the group.
Yeah, feel free to come off mute and off camera so we can see you and ask your questions.
Hey, Douglas, Connie, I'll ask a question while we're waiting to find some in the chat. I'm just curious, in having worked as many policy campaigns as you will both have over the period of time you have, if there's anything you've seen become, more or less important over that time that's changed maybe the way you think we approach things. I'm thinking social media might be an obvious one, but thinking what other things there might be.
Well, I think being able to utilize that, can certainly be a valuable additional tool to what's going on. I still feel strongly that the science-based information is what AHA kind of, that's their strength, and that's their foundation. And being able to share that kind of science-based information with elected officials to convince them that they should support this particular bill or piece of legislation or ordinance or policy or whatever. I think that is definitely still our main asset.
And I would say on our signature campaign, from Belinda, in terms of the question, so the target areas, what we look at, it's a combination of both. So what we look at are a lot of statistics as it relates to CVD and stroke in certain areas, in communities. What we've seen in underserved communities and across the country is that they have much higher rates than the more affluent communities, and that's where we can really sort of move the needle, and that has an impact on sort of where we work. But we look at a lot of different variables, and on the local level and on the state level is where we sort of decide, with the help of our volunteer committees and our advocates, and really sort of listening to, that's a big variable, sort of what agenda we come up with. And every year, the advocacy directors have to come up with a policy agenda. So in North Texas, it looks a little bit different than our statewide efforts, which looks a little bit different than our national efforts. But it really is starting with that base of where are the areas and the people that are most affected by CVD and stroke.
And guys, this is Allison. I will add that we just recently sent out a survey to our entire You're the Cure network in Texas, taking an evaluation of what issues mattered most to our network that the HA was looking to work on for the legislative session starting in early 2023. And if it's interesting to you guys, and if you did not receive that, we can make sure we share that same survey with you all, and we would love to hear back from you on the issues you're most passionate about.
Well, I hope that information's been helpful.
Could I? Oh, sorry.
Dr. Claiborne, please.
Just Brittany. I was on another Zoom and I didn't change my name. Hi, everyone. I was wondering how much of a, would you say that you're getting a fair representation of the people that actually suffer from cardiovascular disease and stroke from your efforts to reach out and say, okay, who's being affected here? Do you feel like everyone is equally represented?
I think that in terms of the effect of CVD and stroke, absolutely not. I think that in African American and Latinx communities across the country, the rates are incredibly disparate as it relates. And so, what we've realized is, in terms of approaching those communities, is that they have different, our policies might change in terms of what we approach. During COVID, especially, it really, the issue of nutrition security came up tremendously, and it's still a huge issue that we're looking at in term, but we also address that federally through Medicaid expansion, efforts in terms of Medicaid expansion. And so we have those umbrella issues, but we also understand, especially in the major urban areas and cities, that we have to do in fact, most of our focus has to do with those disparities in those communities, because that's, as our mission statement said, it's for the health of all people, a relentless force for all people. And so we have really changed our direction in terms of our community impact work and our advocacy work, especially in those major metro areas across the country. Does that answer your question?
Yes, that does. Could you give me a little bit more information about what specifically, I guess two questions. Number one, when we say North Texas, what counties does that?
So the counties that we mainly focus on are Tarrant, Dallas, Denton, and Collin are the four major counties that we cover in terms of the elected officials and bodies.
Okay.
That said, most of our efforts deal, and our policy efforts deal in the zip codes and communities from our community health needs assessment that really sort of, I don't want to say dictate, but really drive where we're working and what policies we're working on because of the need, if that makes sense.
Yeah, absolutely. So I guess the second question then is how is the effort to focus more in on those areas going? Are you seeing an increase in advocacy and participation from those areas, or are you still seeing the same percentage of disparity?
And that's really the whole reason that I came back to this role from a national position, is because we really, on the local level, have seen such a spike and more and more disparities over the last 3 and 4 years. And so it doesn't happen overnight.
Of course not.
You know, it's about building the relationships in those communities, and those community thinking and understanding that when they're thinking about public health, that AHA should come to mind. When I first came back to really work local policies with our volunteers, they were like, well, this is fantastic, this is great, but where have you been?
Right.
You know?
And
well, like, we've been here, you know, and so it's been the last 3 years have been very eye-opening in terms of really working in those communities that have those highest rates of CVD and stroke, and you know, understanding that there really is so much work to do.
Right.
So I think that we have done some phenomenal work over the last 3 years, and we have some work locally on the horizon that is really going to have impact in these communities. That said, it's also tied to our state level work. So, you know, a lot of the federal funds that are coming down, you know, that we're vying for to make sure they're going to the right places, like double bucks or hypertension programs, or, you know, nutrition security or food pantries, that we see if we can sort of create sustainable solutions in these communities, that it's going to help long term.
Absolutely.
So that's definitely our focus. But the state and the local levels, I think, especially here in Texas, are where we're really focusing. So.
Okay. All right. Perfect. Thank you.
Thank you, Brittany. We're going to talk a little bit about youth advocates as we continue. What we're going to be doing in this event series is to really focus on specific policy issues. So in this event tonight, we're going to be focused on heart attack and stroke systems of care. And that brings us to our next speaker, Alec Puente, who is our Texas Government Relations Director. And he is based in Austin, and is going to talk a little bit about our heart disease and stroke policies.
Thank you, Douglas. I'll just give it a moment for the presentation to come up here, but thank you. And thank you, Connie. That was a really good overview of our policy approach and how all of the different pieces fit together for a successful campaign. So thank you. Now I'm going to talk a little bit more about the specifics of our approach to heart disease and stroke policy, who we talked to about that, what we're asking for, and some of the specific policies we worked on and that we plan to work on in the near future. So we can go ahead and move to the next slide, please. So first, I want to give you all a high-level overview of the American Heart Association's goals. While these specifics may change year to year based on, as we just heard, changing science and changing political landscape, depending on what state or community we're working in, these pillars kind of make up our consistent approach and opportunities to improve care for Texans across the board. So first here we have CPR training requirements. You might have been involved in one of those yourself in the past, but for our purposes, we're looking at places that the government has kind of clear authority over training or education requirements. So one example of that is schools. The state government, as you know, sets requirements for graduation. They say these are the things that students have to learn in order to graduate in the state of Texas. We advocated for one of those things to be the inclusion of CPR training, so that now every high school student in Texas is required to learn high quality CPR before they graduate high school. Another example of that is emergency dispatchers, or in Texas, what we call them are telecommunicators. Since the state provides licensure for that job, since they regulate the permit and license that those people in that role have to get, the state can say, hey, in order to be an emergency dispatcher, you should be trained in CPR. You should be trained to coach a person on the other end of the phone through CPR. And so we look for opportunities like that to expand CPR training through where the state has authority to do so. Another example that's a little bit less intuitive, but also very important, is hospital facility certifications. So the state has power to designate hospitals as being capable of delivering different levels of care. So for example, they could say this hospital can deliver level 1 heart attack care, level 1 stroke care, and this hospital can deliver level 2, and so on. And so we advocate for those standards where the state does set them to reflect national best practices, national guidelines, so that patients can expect a consistent, high quality level of care wherever they are in the state. And so ideally what this does is it sets up the entire system to be able to deliver a patient to the most appropriate hospital possible and hopefully get them the best possible outcome for the specific condition they find themselves with. Third on this list is blood pressure policy. Hypertension is often called the silent killer because of its association with heart disease, with stroke, kidney disease, and also with worsened COVID outcomes. And so this is an area where our policy preferences are less settled because, as we said, the best practices are still being learned, the science is still being learned. And so we should expect to see things shift a bit as we learn about what works. But we know that two big pieces of what we consider to be a successful approach will include self-monitored blood pressure programs, that's SMBP. What that is it's an approach that enables patients to have a kind of a longer term, more personally empowering understanding of how their blood pressure changes day to day. And hopefully it gives them the tools and the partnership with healthcare providers to be able to make changes to their own day-to-day lives that improves their blood pressure. And then kind of layered on top of that, we want to see Medicaid take an effective, strong approach to hypertension and incorporate those SMB programs, as well as other best practices that we know will make a difference in improving blood pressure in Texas. And then finally here we have kind of a big umbrella of heart disease and stroke prevention programs. What these really focus on are the operations and the capacity of the government itself. So maybe that's the state health department or the local health department. And what we want to see is we want to ensure that they have, both the organizational capacity, so the employees to be able to run effective heart disease and stroke prevention programs, and also that they have the appropriate resources they need to conduct that outreach, to pull down further grants and, make the best impact they can in the state. We can move to the next slide, Elizabeth. So another question that we need to think about is who actually makes heart and stroke policy, because we can hear about all these ideas, but then we wonder who needs to be talked to get those policies enacted. So the important thing to remember here is that there really are opportunities for heart disease and stroke policy across all levels of government. So at the state level, we have the governor, we have state legislators, and then we have regulators at the state agencies like the Health and Human Services Commission or the Department of State Health Services. And what they do is implement the laws, pass rules that tell people on the ground how they should comply with the laws that the legislature and the governor passed. So some of
Alec, it's important to note, I think, that in some of these campaigns, it's not necessarily the elected officials that are the decision makers. So that we're, the targets that we come up with in our campaign planning process, a lot of times they're the head of the, regional area council at that local level, which you're about to talk about. But our targets change a little bit depending on the campaign. So formal policy isn't always about going and talking to elected officials, but really doing an assessment of who makes the decisions around these issues formally. And so I just wanted to add that. Sorry.
Yeah, no, thank you, Douglas. I think that's exactly the point we're trying to make here, which is that there are a lot of different people who have inputs into this process, and it's worth thinking about in advance. Who are we actually trying to win the hearts and minds of? And so, as Douglas was saying, there are other, non-elected officials like state regulators or people who are involved in regional advisory councils who have inputs into this process at the local level. You also have, as you know, city councils and county commissioners who set up programs at health departments for health promotion. They run chronic disease prevention programs, and they can really direct where resources are going within these regional and local level systems. And then finally, one people don't think about as often as they should are school districts. School boards have a lot of power right now, not necessarily right now, but right now school boards are getting more attention, but not necessarily for the effect they can have over heart disease and stroke policy. And so school boards can implement high quality CPR training for students because we do have that requirement, but of course, there's a wide spectrum of how high quality and how effective that training can be. So school boards can take an active role in making sure that that's an effective program. And they can also, implement effective cardiac emergency response plans. So they make sure that even at that school district level, there's a cohesive system of care to ensure that we have the best possible response to any heart disease or stroke issues that might come up. We can go to the next slide. And so now I think we're going to put a quiz question up on your screen, and I'd be interested in hearing from you all what you think would be the most challenging overall about heart disease and stroke policy. So we'll take a few moments to think about that and answer, and then we'll see if anyone might be willing to explain more about their choice to the group. So I know I've got it up here for me. And I'll read out the answers while you're answering. We got securing the necessary resources, A. B, keeping the issue relevant. C, understanding and explaining complex systems. And D, other.
We'll give it about 5 more seconds.
Thank you, Elizabeth.
Make sure everybody gets a vote. All right, let's see.
So it looks like most people, about 43% of you all, considered understanding and explaining complex systems to be the most challenging part. And that makes sense. I think when I started this job, that's probably what I would have chosen. Now I think I might say securing the necessary resources, just because, we are in a conservative state. There are a lot of worthy causes competing for scarce budget dollars. And so with a lot of urgent and legitimate needs, it can sometimes be tough to explain why an ongoing, well-known problem like heart disease needs new funding. And so, yeah, I'd like to hear if anybody's willing to talk more about it. Just if you're willing to come off mute and tell us about what you think would be most challenging about heart disease and stroke advocacy.
I just want to add that I don't think there's any wrong answer to this, because all of these, and we kind of phrased it this way because they're all a part of the challenging aspects of, first of all, educating folks in terms of the complex systems, keeping the issue relevant. People, unless they're touched by this, like if someone has a heart attack at your house and the EMS doesn't get there until, 8-10 minutes later, every minute that you have an acute event like that, unless you're touched by that, it's not at the forefront of your mind. And then always, because we are a nonprofit, because we are the American Heart Association, as I said, we don't have, our war chest to go in and really influence that way. Securing the necessary resources, and the resources are you all, in terms of us going in and explaining it. What we try to do as staff is to make sure that you are understanding those complex systems that really aren't as complex. It isn't rocket science. It's social science, as I've said over the years. But we try to keep it as simple as possible in terms of our messaging and how we're prepping volunteers.
Yeah, thank you, Douglas. Does anybody else want to share any thoughts about that question? If not, we can move on. But thank you.
I would like to.
Sure.
I don't know if you can see me now because I have a different view on my, but my dad not too long ago had a massive heart attack, and he's the sole provider for the home. And his very thought was, when can I get back to work? But he had open heart. And so he was really struggling with resources like, how am I going to provide for my family? How am I going to get back to work? Who's going to cover this for me? And then another thing is, my dad's very prideful. So I think one of those kind of things, being a Hispanic background, he doesn't know how to take help. He doesn't know where to get the resources. He's just uneducated. But I think that was the reason why I selected securing the necessary resources, is because of the background that my dad has. And of course, heart disease runs in the family. But anyway, that's what I got there.
Yeah, thank you for sharing, Lupe. I think that definitely speaks to, like you said, securing the necessary resources, but also I think to keeping the issue relevant, because like I said, it can kind of become maybe a background issue in people's heads until it affects someone close to them or affects somebody themselves. And I think it's important to, use those stories where we can to remind people how close that line can be.
And this is Belinda Orland. I just want to also say that I think sometimes the AHA mission isn't seen as, as sexy and exciting as maybe people that are fighting breast cancer or something that relates to that, although they come a long way with, making sure people understand it can be women. It's not just, this is what your grandparents are dying of type thing. I think it still has less of a widely seen urgency or prevention aspect to it. So I think that's just something we have to kind of overcome.
Yeah, that's a great point. And I think that kind of gets to the aim of this training and what we're trying to convey, which is how we can, create that urgency by sharing our own stories and sharing each other's stories and, putting a personal face to these issues where we can. So thank you.
Thank you so much for sharing that, Lupe. That's
Powerful.
very powerful. Thank you.
You are very welcome.
Yeah, thank you for sharing.
This is Brittany, and just real quick, the thing for me that I would think would be a challenging issue is I don't think everyone understands what heart disease is, quite simply. Because we think American Heart Association, that means like heart attack, straight up. And it's so much more than just someone having a heart attack or having a stroke. So a lot of it, I think, is just understanding what the AHA does and where that money goes. You know, working with a nonprofit myself a little bit, that's the main question we get is, okay, we're donating, but where's this money going, and what is it doing? Because as you guys have said several times, it is still the number one issue, at least in America. So, you know, what are we doing to change it? What are we working on, type thing? From a public perspective, I would think that they would wonder, you know, what are we doing? Where's the money going, and what are we working on?
Yeah, thank you, Dr. Claiborne. It's a great point, and I think it's something we're always trying to work on. An example I can think of right now is, you know, as you said, issues beyond heart attacks that might not come to people's minds, but Douglas and I and the rest of us are doing a lot of work just trying to figure out how to create that urgency around issues like blood pressure and hypertension that we know lead to a lot of those downstream, you know, severe effects, but, you know, trying to create that urgency, that understanding about how things are linked together and how we can address the issue before it gets to that point. So thank you.
Absolutely.
Do we have anybody else? Well, thank you for sharing, everyone. We'll have another question similar to this where we can kind of share our thoughts, but if there's nobody else who'd like to share on this one, we can move on to the next slide, I think. Yeah, so here we have some recent history about the last 10 years or so about where the AHA has been as far as actual work on heart disease and stroke related campaigns. Keep in mind that Texas has a biennial legislative session, so that means they only meet every other year, an odd numbered years. And so there's a year in between in which, it's really just planning, processing last session and getting ready for the next session, which is where we are right now. And so looking back to 2013, a CPR related bill that we supported and helped pass was the school training requirements for CPR. As I mentioned earlier, students in Texas are now required to learn about CPR before they graduate. One remaining opportunity with that policy is that there were no resources approved as part of that bill to help schools actually enact those training requirements. And so one thing we'd like to see going forward, depending on the budget situation, of course, is the state putting some resources behind that to help, especially some of these high need schools, be able to secure those CPR training kits, maybe secure instructors to deliver high quality CPR training to students.
Yeah, and I would just add to that, what we found is in 2013, when we got the bill passed, it didn't have a fiscal note. So the schools absorbed a lot of the costs. What we were able to do is offset that with our emergency cardiac care arm of the association. We were able to secure grants. And so when it first was passed, we sort of made sure that these kits, these CPR and school kits, were distributed all over, especially in the major metro areas. But that's been 10 years. And so with turnover in staff and just sort of it not being a focal point, the numbers in terms of folks that are being trained when they graduate have dropped dramatically. And we're seeing that across the country, but especially in these underserved communities, because they're, working with these different budgets. With a lot of the funds that are coming to school districts, we are now looking at it as a perfect opportunity. But I think it goes back to sort of that implementation phase of campaigns and evaluation. So making sure that this implementation of laws that we have gotten on the books and worked so hard to get done, but also the evaluation to ensure that what we have passed within the law is happening. I mean, it sort of falls off the radar because it's not, one of these controversial issues, but it's something that can really have impact, because when we see people trained in CPR, they're a heck of a lot more likely to act in an acute event than if they're not.
Yeah, thank you, Douglas. So in 2015, registry funding was approved. This is for stroke, and this is a bit of a technical one, but I'll explain it as best I can. So what this was funding for the state to access stroke registry data from hospitals. So that basically gives the state access to information like response times, like outcomes, like how patients respond to certain different forms of treatment, to delays in treatment. And so that's money for the state to, one, access that registry, to hire epidemiologists to process that data and understand it, and also to conduct outreach to hospitals to basically get their permission to access that data. And so that was a win back in 2015. I think it was about $1.2 million that was appropriated for that. Unfortunately, it got whittled down throughout the years that I'll explain more about a little bit later in this slide. But in 2015, that was a good successful campaign for us. Coming up later to 2020, this is something that Douglas can speak more about if he'd like, but we enacted stroke facility certifications at the North Texas Regional Advisory Council, RAC for short. And what that does is ensure that the Regional Advisory Council system for designating hospitals as delivering, level 1, level 2, level 3 standards of care match those of the national best practices. Douglas, do you have anything you want to add about that one before I move on? I know you.
No, I just think that in terms of,
so want to be able to give details.
To Brittany's point earlier, folks just aren't aware that there are laws and policies around when you have a heart attack, all the way to when you get to the hospital, to after you're released from the hospital, to ensure that you're taking you have access, first of all, to prescription drugs that you're prescribed, and that we're following up, especially in certain populations, especially elderly folks, to ensure that they are actually taking the prescriptions so that the heart attack doesn't happen again.
Rehab.
Yeah, and rehab. So there's this whole system, this comprehensive system that we're advocating for in terms of policies that folks really a lot of folks just think that it just happens, and it doesn't. So yeah, we worked regionally because the statewide legislation that we passed in terms of the implementation still had some gaps. And so we worked with these regional area councils, which are made up of EMTs and doctors and nurses and healthcare professionals that are part of that continuum of care, this comprehensive system of care. And we were able to get that done. But it really is about education and making sure that people are aware that this system is there and that it should be working properly.
Yeah, thank you, Douglas. And so to sum that up, basically what getting that done ensures that, basically from EMS all the way through, delivering care to follow up, that there's a comprehensive system for that entire region for making sure that the best possible stroke care is delivered. In 2021, that was last legislative session, there were a few different things to note. First was the CPR requirement that we helped pass. EMS training specifically, that was for telecommunicators, like I mentioned earlier. That's TCPR for short, telecommunicator CPR. And what that bill does is ensure that as a condition of getting their license, that every telecommunicator in Texas has to be trained on delivering high quality CPR coaching through the phone to a caller. And every 2 years, they will have to recertify that they have had that training, are qualified to walk a caller experiencing emergency on the other end through high quality CPR. Secondly, in 2021, that stroke registry funding I mentioned earlier was eliminated. That actually goes back to when COVID first hit and state agencies were directed to identify they make in an uncertain situation. And one of the budget cuts that was identified was that stroke registry funding. So that was unfortunately eliminated last session. And then third, last session, or not last session, this past year actually, we had those stroke facility designations that Douglas mentioned updated at the state level. That actually happened a few weeks ago, and now all facilities in Texas will be subject to those same hospital certification guidelines that started off at North Texas. Representative Tinderholt, see you joined us there. Thank you. We're just wrapping up this portion of the presentation. Elizabeth, we can go to the next slide. Now, another question for you all when the survey comes up for you is just what level of government you would be most interested in advocating at. Again, there's no right answer, but I'd be interested to hear what interests you the most. For me personally, I like the state level policy. I just kind of enjoy the pace of it because like I mentioned, Texas meets every other year. And having things compressed in that time frame, I think is really exciting and interesting to see how such important things can come together so quickly. But we'll give you another, looks like maybe another 30 seconds here and see what the group thinks.
Yeah, I see 12 people have voted out of 24, so feel free to chime in.
Yeah, or as Andy says in the chat, all is also an option. We will not stop you from getting involved in every campaign we join.
I like it, Andy.
That is the right answer. I was wrong when I said there was no right answer.
You should have put all the above. All right, I'm going to end the poll and see how we did.
Well, we'll call it there. Looks like most of you all feel the same way I do, that the state level is very interesting to you. But does anybody feel like sharing your thoughts on that question, or why you chose what you did? Excuse me.
I'll go for it. This is Brittany, of course. So for me personally, heart failure hits home for me because it happened when I was very young. I was 26 and was diagnosed with peripartum cardiomyopathy. So essentially I had a heart attack during labor. And as Texas, one of the other things I noticed about Texas is it's growing very rapidly. And because of that growth, I think that more people, more women are starting to have children. So for me, being able to be at the state level and spread awareness about peripartum cardiomyopathy and the fact that heart disease doesn't have an age range that it works within. It absolutely will affect everyone at every level. And to be cognizant of that and to be aware of that is really, really important for me. So as a person that went through that, my son is 11 now, but we are very, very committed to making sure every year that he has a physical to make sure that his heart is doing what it's supposed to do and that there's no abnormalities or anything like that. Not because of a genetic thing, but just because we understand it could be something very small, like, high blood pressure today, which tomorrow could cause something very serious.
Thank you, Dr. Claiborne. Yeah, and I should have also pointed out another motivating thing about the state for me is, as you said, one of the broadest impacts you can make, especially in a fast-growing, huge state like Texas, is at the state level, and it's interesting and exciting to be part of policy change and reach so many people. Anybody else have any thoughts before we move on to the next slide? No, well, that's okay. We can move on to the next slide, Elizabeth. So quickly, I'll explain some of the upcoming priorities that you can be involved in if you're interested, specific to heart disease and stroke policy. So one of those is hypertension programs, like I've mentioned a few times. We'd really like to see state and local programs that improve care and support for hypertension control. There are a lot of different ways that can look. One idea we're kind of shopping around right now is to look at different ways we can reach community members outside of traditional clinic settings, maybe in rec centers and senior centers to help them, set them up with self-monitored blood pressure equipment, with training to address hypertension in more localized communities. Second, we've got Medicaid policy. Obviously, we want to ensure that heart disease programs can be delivered via telehealth. That's a really important topic right now with so many people being reluctant to go in person to get care. And we also, again, want to encourage the use of those SMBP self-monitored blood pressure devices through Medicaid. And then finally, like Douglas mentioned, we really want to see resources appropriated for school CPR training. We know that requirement is on the books, but that kind of the quality of instruction has been declining, and we want to make sure that students not only are getting that training to graduate, but are getting high quality training and are actually equipped to go out in the world and act on an emergency if they have the opportunity. So we can go to the last slide, Elizabeth. And so finally, I want to talk a little bit about messaging heart and stroke issues. We'll talk a lot more about sharing your story, how to make that an effective opportunity after our break with Allison. But quickly on the specific topic of heart disease and stroke issues, I wanted to share a few best practices. One is it's always a good idea to emphasize personal stories that demonstrate the need for good policy. We talked a few times about how complex these issues can be, how sometimes they can fall off people's radars. And so it always helps when you can share a story, whether that's your own story, you can share a video that maybe the Heart Association has already kind of packaged up to explain this issue. Or I've also, found it effective sometimes just to share a hypothetical. Imagine you are this sort of person and this happens to you. What would you do? That can really put people in the shoes of, a hypothetical story and create some urgency around the issue. Secondly, because they're so complex, it can be easy to get bogged down in data, explaining exactly how many heart disease deaths there are, how many people are affected by it, splitting it up all the different ways. But really, you just want to deliver the main point, which is what we know. The heart disease is still the #1 killer in America, and it touches every one of us in one way or another. And so you really just use the data in order to emphasize the importance of the issue, but to the extent you can, you want to lean on your personal story and also lean on data from their district if possible. So if you are using that data, they can understand how it affects their community, specifically their constituents, their voters. And then finally, you want to emphasize fairness and equity. Fairness is a cross-cutting political value. It's something that everybody kind of agrees is important. And especially for these issues, whether it's CPR training or hospital facility certification, what we want to do is ensure that as many people as possible have access to the best possible care wherever they live. And then with that as kind of the basis of our policy, I think it can be a much more effective approach. And so finally, I think we can move on to the next part of our presentation, which is our lawmaker moment with Representative Tony Tinderholt. Representative, I saw you join. I'll give you a quick introduction. Representative Tinderholt is a father, a retired combat veteran, and a state representative from House District 94. He's serving his 4th term in the Texas legislature, representing the people of Arlington, Dalworthington Gardens, and Pantego and Tarrant County. Representative Tinderholt serves on the Committee on Homeland Security and Public Safety, as well as Committee on Defense and Veterans Affairs. He was actually present as a member of the Committee on Homeland Security for our very first hearing last session on HB 786, the bill that required all telecommunicators in the state to be trained in CPR. He is the chairman of the House Veterans Caucus, and he serves as a floor leader for the House Republican Caucus. Before his state service, he had a decorated military career. In his 21 years in the armed forces, he served tours across several continents, and among other accolades, he was awarded the Bronze Star and the Combat Action Badge. Representative Tinderholt is a proud father of his 4 children and 2 grandchildren, and is happily married to Bethany, a loving mother, executive director of the Arlington Police Foundation, and a former Dallas Cowboys cheerleader. Representative Tinderholt, thank you so much for joining us.
Absolutely, and I became a grandpa one more time last week, so a 3rd time that you didn't know about, and it's brand new to my family, so there's no way you'd know, but it's making me feel old.
No, well, congratulations. We'll have to edit that bio for you, but congratulations. Thank you for joining us.
Absolutely.
Well, Representative, to start, could you maybe talk to us a bit about how constituent outreach is factored into your own lawmaking career and your approach, and especially anything you recommend for us advocating to lawmakers?
So the first thing I want to tell you is, when it comes to topics like this, and there's a lot of them, Party doesn't matter. I don't care what party anybody affiliates with when I represent them. When the elections are over, I represent almost 205,000 people in Arlington, and my job is to listen to them and do the best I can. And if I can't help them, I'm going to refer them to another legislator that can. So I want to take the fear out of anybody contacting their legislator because you might be a Democrat, they're a Republican, or you might be a Republican, they're a Democrat. Our job is to represent you regardless of what party you affiliate. Now, I would also tell you that there's no reason to really talk about what party you affiliate with when you go in and meet them. Because the topic about heart health and heart well-being really doesn't have political boundaries. It's not a divisive topic like voter integrity and pro-life or pro-choice. It's not those things. This is something that's really important to everybody, regardless of what political party they affiliate with. So my first advice would be to fear no elected official, because we work for you regardless of who you are and what you do and what you represent. My job is to hear you and then try to find a way to help you. I would tell you that when you go to the Capitol, if you go to the Capitol during session, I would come semi-prepared, and I would not have 2 or 3 pages of paragraphs. What I would tell you is I would have something that's kind of like Cliff Notes, that's really simple, kind of outlines what's important to you, and then talk them through it. And in a friendly way, maybe hand them a pen and say, can you take some notes while we're talking in case you have questions? We're human too. We were just the people that decided to go run for office. I'm no different than you. I got a full-time job, I work, I've got kids, and it's painful to go down to Austin and leave my family, but it's so worth it. And the thing I like to tell people is we don't know everything. Some of us think we do, but I'll tell you, I don't know everything. You do. You know way more than I do about heart health, and you know more about the topic that is important to you. And so when you come, know that most of us have our ears open and we want to hear you, and we want your ideas, and we want to know how we can fix and solve and help you be successful.
Thank you, Representative. That's great advice. Well, I want to invite people to drop some questions into the chat if you have any for Representative Tinderholt. But first, I know Allison, you had a question you'd like to ask. So why don't we leave it open for you?
No, I do, and I will be in full transparency, Representative Tinderholt. First of all, thank you for being here with us tonight and sharing everything you've shared so far. It's really inspiring. But I am the grassroots manager for the AHA, and I do work with all of our amazing grassroots advocates, all of which are on this call tonight. So we're thankful to be able to hang out with you. But can you share a little bit more with us about kind of the impact of when advocates share their stories with you, whether it's by social media, and they share why an issue matters to them, or if they're sitting in your office sharing that, or make a phone call, or maybe they tweet you. Can you just talk to us kind of about those? There are a lot of different ways constituents can reach out to you and share why something's important to them. And we're going to talk more about that after the break. But I just think it's going to be really interesting for our advocates to hear from you about how those things matter.
Absolutely, and I apologize. I have a cough drop in my mouth, so I'm not coughing all over you guys the whole time. I've been having a cough for about a week now. The advocacy is really important. And the one thing I want you to remember is you probably know more than we do about the topic you're coming to talk to us about. I'm just being honest. You probably know more about the American Heart Association, or you know more about whatever topic it is than most legislators know. So when you come to us, come ready to inform us. The best advice I can give you is don't come with a negative attitude, because it automatically kind of puts up our defenses and we don't hear you. But I'll tell you, when you get us email, and when you call, and when you text, and when you show up to the Capitol, you guys influence our decisions. Contrary to what Facebook says and what keyboard rangers write horrible stuff about us, that we're taking tons of money from this association. I'm going to tell you, that's not true in most instances. I'm sure it happens, but in most instances, we're just trying to serve the public, and we get money from different places, but the money that we get does not influence my decisions. And I don't think it influences most. Remember, I said most. I don't think it really affects most people's decision-making when it comes to the well-being of all Texans. So if you come with a really good attitude and you come trying to educate, and then when the legislator kind of acts like, oh yeah, I know that, up your game a little bit, go from the kindergarten level to the 5th grade level, and then go up to the senior level and coach them through it. But there's several instances where I have had my mind changed or partially changed. Most of the time, it's a partial change. It's not usually a full change. Several examples of that. Well, I'll give you one really good one. I was in the military for 21 years. I had a security clearance. I've never tried marijuana. I've never tried illegal or illicit drugs. And so when people wanted to do marijuana, medical marijuana, it was a hard no. I was absolutely no, there's no way we're doing it. I had a couple of families come into my office, and I'll never forget Jessica, a little 16-year-old girl, had her driver's license, couldn't drive. They brought her there, and she was adorable and sweet. And I likened her to my daughter, who's now, 31, and I've got a 5-year-old. But I thought, gosh, this little girl can't go to dances because she has seizures. She can't drive a car. She doesn't have a boyfriend. Most 16-year-olds want to at least learn how a boy is supposed to treat them, and they want to date a little bit. And if the parents allow them to, it's actually a really good learning experience. But this little girl couldn't do any of that stuff. And they showed me videos of her on a day-to-day basis. And then they showed me videos of her taking a gummy bear in Colorado. And it was night and day. I almost cried. And then to follow that appointment up, it was advocacy day for medical marijuana. Another little girl came in that was 14. Very similar stories, videos of her after she took a gummy bear with no THC in it. You gotta remember my mindset. I did counter drug stuff. I stopped narco traffickers from bringing stuff from Colombia and Mexico into the country. I worked to stop drugs coming in. That was a hard no. Voted yes on that bill because it was right for Texans, and it was right for those little girls, and it was right for the little boys, and it was right for the middle-aged and the elderly that were having issues. If a doctor thinks it works and it helps them, we have to trust them as legislators. And I had to take that hard stance off. I had to take it away and put it aside and realize what was best for Texans, and that I couldn't keep thinking that all marijuana is bad, because there are medical situations where they take the THC out and it works. And honestly, that's probably the best example. That was one of my hardest no votes that I switched to a yes. And it was because people came in my office. But I had the opposite. A guy from my district here came in, talked about medical marijuana. I'm going to tell you the opposite. Rolled in his wheelchair, talked about medical marijuana. Him and his girlfriend were playing really rude, touchy-feely stuff. And my staff felt like it was fishy, so they looked him up on Facebook, and they're talking about smoking bowls of marijuana and partying. Hard turnoff, right? Maybe not want to vote for it, but we're able to balance. We can take the people that come in and do the wrong thing and the people that do the right thing, and we can make the right decision. But that's a long way of telling you, we can usually be switched partially, but that was a hard switch for me. That was from a hard no to a hard yes. And when I say hard, soft yes, yeah, they could maybe change my mind, but I was a no. No one. My chief of staff and I had arguments over this late at night, and then I ended up flipping my vote and changing. So you guys matter. When you come talk to us, you can change our minds.
So Representative Tinderholt, we have a question in the chat that I wanted to share with you. Belinda asks, do you weigh a phone call of higher significance than an email?
Nope. I have a district director that handles all advocacy work. So if you call, she writes it down. If you email, she prints the email.
She's fantastic, by the way.
I appreciate you. Shannon is amazing, and Shannon is the one that, so my chief of staff keeps me straight in Austin. Shannon keeps me straight here in Arlington. I want to remind you, I own a business. I work 60 hours a week. I have a full-time job. So I meet with her every Wednesday from about 8 until noon. I meet constituents during that time, and we go over all the emails and all the phone calls, unless it was an emergency type phone call where someone needs to get a roof over their head, or someone has a leak, or their air conditioning isn't working and it's 105 out. But she handles all the advocacy stuff. I don't care whether it's a phone call, a text, an email, or a Facebook message. If I get the Facebook messages or texts, I forward them to her immediately, because I have to make sure that she and my chief of staff are aware of everything that's happening. But every Wednesday we talk through them, and it doesn't matter how we got the info, it's all the same to us. or at least to me.
Thank you, Representative Tinderholt. Do we have any other questions for Representative Tinderholt before we let him go? We really appreciate your time.
Yep, and I'll tell you real quick, a lot of you may not know, I have an aortic valve replacement. I have a titanium heart valve. I live with heart disease, and heart health is important to me, and it's important to everybody. And the bill that you were just talking about, a very dear friend of mine authored that bill, and I co-authored it, and I think it's probably, those types of bills are some of the best bills that we pass, where we can get Democrats and Republicans to do the right thing. If you call 911 and you have a child at home that needs CPR, I want the person on the other end of the phone to be able to instruct you on what to do. And it's really important. So that bill was good. And that was partially because some things that happened with his father. And that was partially because of advocacy, people coming around talking to legislators to get them to co-author and support that bill.
And I'm super excited you shared that, Representative Tinderholt, because we will actually be sharing a video from a family that the AHA, we shared their video during our campaign on that bill. And we will be sharing that after the break. So that's a really good segue to our break.
Perfect. Thank you all for what you do, and be involved. Don't let any elected official scare you, because we work for you. When people think that elected officials think they're here, I will tell you that the right elected officials know that you're here and we work for you, and we are not above you. We work for you.
Well, thank you, Representative Tinderholt,
Thank
for all
you.
your great advice and for your time. And we got a lot of advocates here from Arlington, so hopefully you'll be hearing from some of us soon. But thank you for your time, and congratulations again on your new grandchild.
Thank you all. Have a good night.
Okay, well, everybody, thank you for your attention for the first part of our Heart Spark advocacy event. Well, that brings us to our break. You want us to stretch, order your food if you haven't yet. Use a restroom. Be sure to come back for the final part of today's session, where we'll learn about sharing your story with elected officials and take part in an activity using the gear we had sent you all. So enjoy your break, and we'll see you back here in 10 minutes. Thank you.
Okay, welcome back, everyone. We hope you had a great break and enjoyed the first half of our program. We are almost done. In case you missed my announcement at the start of our program, we had a little hiccup with Uber Eats. We sincerely apologize for that. It was beyond our control. I spent about 45 minutes on customer service line trying to fix it, but we are going to make that right for you all as soon as this is over. It's just one of those things that just is out of our control. So thank you for understanding. We will send you another code that will not have a expiration date on it that you can use at your convenience. So thanks again for giving us that grace and for understanding. And we're going to go into our last portion of our event tonight, and that will be with our grassroots manager, Allison Hogue. So Allison.
Yeah, let me come off mute. That has to happen at least once on a presentation, right? If everyone can come off of their photo and text and show us your video for just a moment, we promise. We actually want to take a group photo of everyone that's on the call tonight, so everyone get in all the right spaces. We totally understand, because if you're in your pajamas hanging out with us tonight, we're so excited you're here, so that's fine too. But for those of you that feel comfortable coming on video, we would really, really love to see your faces. Oh my gosh, I love this, every minute of it. So we'll give everyone just another moment to pop on. Okay, Molly, the factor in my car makes me so happy. Let's try this. Do not drive and be on this video though. Be safe, kiddo.
Awesome. Y'all look great. All right, we're going to take a print screen. That's okay with you guys. All right, give us your best smile. All right. Let's see if that worked.
We good, Elizabeth?
Allison, you got it?
Yeah,
I did it.
I did it with my phone as well, just for backup, because we need all the backups for things. But yeah, we're good. And I love seeing you guys. So, okay, with that in mind, Elizabeth, do you want to start our slides? And we will do all the fancy things that our grassroots. I'll just tell you guys, I do not present in the exact same way as my amazing colleagues, Douglas and Alec. I'm much more casual, and had so much fun chatting with you guys in the chat feature on our Zoom. And some of you guys must have been like predictors of things to come, because when you asked about things like youth advocacy and hearing from young people, oh, but are you going to hear from them? But the first thing you're going to do is hear from me. So are you ready to share your story? And if you're not, I promise you will be when we're done. So next slide, Elizabeth. So it wouldn't be fair to ask you guys to share your stories at the end of this conversation without first sharing mine. And sometimes this is hard, but I'm going to do it. So please meet my two sons. Dalton is 22 and Garrett is 19. I have to almost stop calling them teenagers, which is a little alarming to my mom brain. But my sons were 4 and 6 months old when my mother at age 55 died from heart disease. She was exactly the story we talk about in our Go Red for Women campaign, about a woman that was so busy taking care of her kids and her grandkids, she simply didn't get her own heart checked out. And symptoms that she thought, I'm not having a heart attack, but I have symptoms. She took care of us first. And from this tiny little woman, which I mean tiny, you guys, she was 4'11" and weighed like 110 pounds. She had a heart issue that was undiagnosed, and we lost her at age 55, and it had a tremendous impact on my life. This was before I worked for the AHA, so I was an advocate for the AHA before I worked here, and continue to be an advocate, even though now it is a great privilege to be able to work for the American Heart Association and advocate for my mom and all the other families out there. So that is a little bit about my family, and that's my story. So next slide, Elizabeth. So next, I want you guys to hear from a rock star of a kiddo that is from the great state of Texas. And he wanted to be a part of our event tonight, but had a school commitment, but he for sure recorded something to share with you guys.
Hi, it's Andre Scott here, a Texas youth advocate for the American Heart Association. I'm excited to join you today and share a few reasons why sharing your story matters. First, the AHA has the science and facts behind the policy, but your words are what bring the policy to life for lawmakers. We don't have to be policy experts, but lawmakers need to hear how policy change will impact people just like you and I. Lawmakers need to hear from home when they are at Capitol or in City Hall. And advocates have a tremendous impact. After all, you are voters, and I'll be one too in just a few years. Your stories help make policy change happen and inspire new advocates to join us. Next, Allison is going to share more about the impact of stories. Thank you, and have a great evening.
Oh, I appreciate that, kiddo, so much. You will hear more from him in the future because at the very young age of 15, he's just starting his advocacy journey with the American Heart Association, and there are great things in store for his journey with us. So be sure to stay tuned. Andre also writes a blog for us, which if you subscribe to our e-newsletter, you're probably seeing that. So although he lives in South Texas, he is going to help us speak to many issues across the great state of Texas. And you may just see him testifying in a committee meeting next legislative session. Next slide, Elizabeth. Okay, you guys, many of you, if you are in our Year of the Cure network, if you were involved in our work on telecommunicator CPR last session, you likely heard this story. But I wanted to be sure for those that have not, or just a reminder, the story of the DeMarco family was a tremendous story and impact on the policy we were working on, which Alec has already talked about, successfully passed. But we wanted you guys to hear that. Please bear with us. This is a little over a minute video, but Allie sharing her dad's story really made a difference, and I think impacted lawmakers so they could understand why TCPR needed to be passed.
Woke up that morning and was going to do my regular training that I do, and I was getting on a bike and I really wasn't feeling well at all.
And I remember I was literally right about to walk out the door.
I heard Allie was about to leave, and I was able to muscle just the words, you know, Allie.
And so then I decided to call 911, and they answered, and they told me to flip my dad on his back.
Turned me over and, you know, checked, you know, vitals and stuff, and then they realized right away that I needed CPR.
I put my phone on the couch, and they would count for me, and they were like 1, 2, 3, 4, and I would just press down to the beats.
She wanted to know when the paramedics were going to be there, and the 911 person was like, you know, your father needs you right now. So you can do it. Just, you know, come on, you know, stick with it. And, you know, luckily she was able to continue and able to, you know, keep going until the paramedics got there.
The girls were standing outside and they're crying, and they come running towards me. And the first thing that Allie said was, "I don't think I did it right." And I just remember looking at her and saying, "Baby, whatever you did was perfect."
So many of you guys saw that video. We put it into many of the action alerts that we sent out, and we shared that on social media. And if you, I have seen it more than a dozen times, probably
woke up that morning and
a ton. And the story is so moving, and especially it's being shared by a young person. But that family story really helped us move the needle and get the attention of lawmakers. And it helped us get the attention of Texans that maybe didn't understand the need. So many people say to us when we're working on TCPR, wait, this isn't already a standard. No, actually, it's not until we work on this legislation to make sure that is the case that every Texan, that the 911 operator they would call would have that ability to communicate over the phone how to do that. And Allie and the DeMarco family were able to share that in a way that was tremendously impactful. So this was a really amazing example. It was just used this past session of how a story made a huge impact. Next example. So this one is super fun. Many of you guys have seen this recently. We did a call for stories. We do this oftentimes on social media or through our network, just to kind of, in a blanket ask, there's no specificity to this, like whatever your story might be about how heart disease or stroke have impacted you. And I think this was addressed earlier. It is such a large issue, and there are so many different ways that heart disease or stroke can impact your family, your neighbors, someone that you know and care about. So whether it be your story or someone that you know, in this example that was given and that we shared, this is actually a pediatric nurse, and she is only 22 years old, and she was sharing why she was passionate about advocating for heart health, and that's this video.
As a pediatric nurse, I'm an American Heart Association advocate to educate the younger generation so that they don't experience the fear of losing a grandfather like I did as a child, and for my state, so heart disease will no longer be the leading cause of death.
So again, it's super quick and easy, which is just going to come back at the ask we're going to make of you guys at the end. But this one was super fast. I want to say this is about 15 seconds, but it's super quick and easy. But the impact of videos, both on social media and with lawmakers, is tremendous. Next example. This is one of my favorites, and this will kind of stem into some things we're going to talk about on part 2 and part 3 of this training. But please meet Katura. And Katura has been an advocate with us for many, many years. She actually is a part of our Real Women campaign and our Go Red for Women movement right now. So you may have seen her through that. But Katura has met with her lawmakers both at the state capitol to Washington, D.C. She's made phone calls. But Katura shares the story about her family, that she has 3 young children. She is a single mom. She is working towards obtaining her college degree, and about her concerns as a heart and stroke survivor. Katura actually has had multiple strokes and a heart attack. And when she shares her story, but also in the timeliness of right now, this is my biggest concern. And sometimes it's around healthy school meals and what's served to her kids in schools. But she has done an amazing job of, during the pandemic, which is the photo you see at the bottom. This is meeting with her member of Congress via Zoom, like we are today. We definitely know we all learned the power of Zoom during the pandemic and continue to do so. But Katura did a great job of reaching out to her lawmakers and being sure that she was still sharing her story, and the impact that made just continued to resonate. Lawmakers, when they hear her story, and she's built a relationship because she's meeting in person with them, making phone calls and sending emails, they recognize her name. And when she meets in district, which we are coming back to a space where we can do that safely now, when she walks into their office, they know who she is. So building those relationships as an advocate with lawmakers has a tremendous impact as well. Next. So we are going to ask you guys to share your story. I'm pretty sure you probably knew we were leading up to that. But what I want to tell you is a little bit more about how we're going to use those stories. There are a lot of different ways and more ideas that we're still working on. We are a very innovative group, and we're always trying to find ways, both partnering internally, but talking to you guys about how do you want your story shared, whether it be a one-on-one meeting with a lawmaker, if you feel comfortable testifying in a committee meeting, sharing that on social media, in our You're the Cure newsletter, or in emails we send to our network. We love sharing those stories. And then oftentimes, just as we are making presentations and we are able to talk about the work that you guys do, as I've done with Andre and Katura and Sophie that have shared their stories previously, we love bragging on you guys. So anytime we can translate the work we are doing through the impact it has had on your lives and how we can make policy change happen. It's exactly how we want to be able to use those stories. Next. Okay, so the most common question when I ask, are you willing to share your story, is, well, what is my story? It's very easy for us to say if you're a survivor or you're a caregiver of someone that is a survivor, that seems to be something people can identify with quickly. But we want to reach past that with you guys and find a space where, whether it's a family member or maybe it's a friend that has shared their story with you, or something that's impacted you. Maybe last session when we worked on telephone CPR, you were impacted by the DeMarco family story. And you know that in the future, if that is the situation your family is in, you want to know that a 911 operator is trained appropriately to be able to deliver that life-saving care. That could be the story that's inspired you to share your own story. Also, an issue you're passionate about. I know I have 2 young adult kids. The vaping epidemic is hitting front and center in not only in our home, but with friends of my kids. And it's something I care passionately about, and I feel very comfortable talking about and advocating with lawmakers. So maybe it's a specific issue that means a lot to you and that has really hit home. And lastly, and these two connect, which is a concern you have for your family, your kids, yourself, or your future. So whatever that might be, oftentimes we take an extra special interest in an issue just because we know the impact it's going to have on future generations. So with all of that in mind, I have something really special to share with you, which is one of our youth advocates, which made it really crazy that you guys were talking about youth advocates earlier in the call. So for all those that put that in the chat, thank you. So you're going to get to hear from one, and not only one, but you're going to get to hear from an amazing one. Abigail Davis, I should call her by her official name, but she's Abby to me. Abby is our Youth Advocate of the Year from 2019. She is also an AHA vlogger. If you have seen her vlogs out there, she's been writing for us for some time. She became involved with the American Heart Association when she was a sophomore in high school. She is now a junior in college, but she has done a ton of videos and a ton of vlogs for us. So she has a lot of experience in sharing her own story and also interviewing others to share theirs. So I wanted you guys to get a little feedback tonight from her on how she has kind of developed some best practices for doing that. She also has one of the handy dandy ring lights that hopefully most of you received. And please let us know if you did not receive that in the mail. So she's going to give you a few more talking points on how to use that to create your own video, and we will lead into that. So Abby Davis, it's all you, kiddo.
Thanks. First off, hi everyone. It's so much fun to do these things and be interactive with you guys. So like Allison said, I'm never going to want to ask you guys to share your story if I can't share mine with you. And that's what I have been traveling the country doing, is sharing my story. And I think that's a really impactful way to get people involved with the Heart Association. So for me personally, I actually have 2 main stories. The first one is more of a personal connection, where my grandfather passed away from heart disease whenever I was 16 years old. And he wanted me to learn so much about the Heart Association and heart disease in general and how to prevent it and detect it. And so it's just been my mission. And then the second one is that I actually saw my brother go through a really bad vaping addiction. And because of that, I've been able to talk to lawmakers and talk through legislation with so many different people because I am passionate about that. And I had no idea, even at the time, whenever my brother was going through that it would affect your heart in such a bad way. And so that just created 2 really main big stories for me. But I do actually have a vlog for the American Heart Association. Yes, you heard that right. It's a video blog. So videos are so important to me. That's how I'm able to capture an audience. So there are a couple of tools that I'm going to tell you guys to make the best video. First off, the lighting has to be good. Where I'm at, it's about to start raining. It's also nighttime here, so it's really dark. Honestly, I wouldn't do a video at nighttime, especially if I was near a window or anything like that. Just not the best lighting. You want it bright and you want everyone to be able to see everything. You want it to film horizontally, so you don't want vertical, you want horizontal. And then limit your background noise. I'm a college student. I have roommates, so they even knew that I was doing this. So I was able to tell them, hey, just for an hour or so, let's just keep it on the down low, because even me, I have huge ADD problems. And so if I'm watching a video and there are so many things going on, I'm gonna get so distracted. And so I want to make sure that whatever video y'all are doing, it's just of you guys and everyone's able to hear y'all very clearly. And then like Allison was saying, these videos are really short. They don't and dramatic. It is hard to keep an audience for that. These videos only really have to be 30 to 90 seconds long. And then I want you all to involve other people. I know sometimes it's scary to just get in front of a camera and just do it all by yourself. Get your friends and your family involved. I've gotten my grandfather involved in so many of my vlogs, and it's just been so fun to do that with him and even create that bond and share a story with each other. And then if you really like one of your videos, so if you take one really good take and then there's something, just one part of it that you're like, oh, I wish I could cut that out, ask the Heart Association, send it to them. They have amazing editing capabilities. And so I know that they will be able to help you in that way. And then also, they're never going to use your videos without your permission. So don't think that your video is just going to end up on some website that you have no idea. They're going to ask you to use your video. They're just really wanting to see you guys get out of your comfort zone, share your why. And so that's exactly what I'm going to do with you guys today. I'm going to share, I'm just going to use my little tool that we all got. I'm only going to put it on the first level, but there are 3. I know you guys have probably figured that out by now. But I am just going to do a quick video of myself and just practice and show you guys. So I'm going to put this right in front of my camera, and then I'm just going to do a quick video and then I'll show it to you. Hi, everyone. My name is Abigail Davis, and I am 21 years old. My why for the American Heart Association is that my grandfather actually passed away from heart disease whenever I was 16 years old. And then my brother also went through a very hard vaping addiction that made me really want to be an advocate for the American Heart Association. And it's really that simple. Y'all can see like the lighting's pretty good on there. You know, I am a college, so I don't have like many abilities to go everywhere and have like a cute background, but sometimes I want to go outside. But it's just really simple. Share your why with them. You can message it to them on so many different ways, but yeah, that's all I got. So thank you guys for letting me be here.
Thank you, Abby, for hanging out with us. And I know that's a huge commitment when you're trying to carry a load of classes at school. So we're thankful for all the work you do for the AHA because it is a ton. Okay, so let's get to that video. So I'm actually excited. I'm going to try not to jump to the next slide because there's something super cool waiting on the other side of this, but let's recap. We want to hear from you guys. We want to hear your story. We want you to share why you're an advocate or who inspires you, why you're passionate about a policy, maybe something we've discussed today, but it's okay if it's something outside of that. And be creative. Like Abby said, if you want to go outside and film it, if you want to film it with, you know, one of your fur kids in your house, if you want to film it with your spouse, if you want to film it with one of your kids, whatever you want to do. We do ask that it be between 30 and 90 seconds. That's the best clip for us to be able to use on social media and beyond. And then please film it horizontally. And then your options to submit, and we will totally put this in an email to you guys tomorrow, is you can text it to me at my cell phone number. You can email it to me, or you can go to our Facebook page for You're the Cure for the American Heart Association and message it. Once you send those in, that's really just a filter for those videos. If we will follow up with you if we choose to use it somewhere and tell you how we're using it, get your permission before we do so. So don't think because you're sending this to us that it's going to show up somewhere. I promise I will ask your permission and let you know kind of the frame and context in which we'll be using it. Next slide. Here's the fun part. If you choose to submit your story in the next 3 days, so 72 hours, this homework assignment does have an expiration date. I hope you all enjoyed the swag you received in the mail. And if anyone has not received it yet, I feel very confident showing up soon. But if you've not received it, please let us know. but there's something more fun coming. And I have one here. So the photo is in front of you, but this thing's super cool. So it actually is a phone charger. So phone charger, which will charge your phone, and it lights up with the AHA logo at the bottom, but it also is a Bluetooth speaker. We really want to put these in the mail to you guys. So for everyone that submits their story via video to us via text, email, or on our Facebook You're the Cure page in the next 3 days, we're going to drop these in the mail to you as your next amazing swag item. So we're really excited. These are cool. We've tested them out. They're really fun to have on your desk. I prop my phone up on it. Now my phone does not die all day, because if anyone else is notorious for that, my phone is almost always dead and dies all the time on phone calls. But this thing helps me not forget to do that. So we would love to send that to you as a thank you for sharing your story with us via video. And guys, it can be any story that you're comfortable sharing, or just practice your skills and send it over to us. Again, we won't use it without your permission. So next slide, which is the easy part, which is questions. Does anyone have any questions for us?
Allison, this is Allie. Could you maybe just explain to the group how do I put this? You know, the DeMarco family story we ended up repurposing, you know, kind of later into a Texas campaign. Yep. So just kind of how how those can end up being used downstream in ways we didn't anticipate.
Yeah, so actually the DeMarco family story was something that was shared with one of our development colleagues. And that, even prior to us working on telecommunicator CPR, or TCPR, as many of you guys probably know it, was shared with our development team. So I believe it was used at a Heartball event as just a story to understand the impact of our work. And because that story was shared with our development side of the AHA, we took notice of that, and we knew this was a policy we were about to start working on. So we reached out to them and asked if they were comfortable with us using that story in a different way. They were over the moon, because at that point, when this was shared with our development team, they didn't know that this was something we would, on the policy side of the house, be working on very soon. So that's something else, is as you guys share your stories and how you are impacted by issues that the AHA works on, you never know how that can change the work that we do.
Okay, Allison, we have a question. Did you say you would text your story, or do you have to video? I think you said to text the video, correct?
So I will say this, we would love to have videos, and yes, you can text that video, because for some people, if you record the video on your phone and you can text it straight to me, that's fine. If for any reason a video is not a comfort zone for you, please feel free to simply email your story to us. Maybe include a photo if you'd like to do that. I am happy to work with you guys and find whatever media you are comfortable sharing that in. A video seems to be the most impactful for a lot of the purposes that we are learning this. I mean, we are in an age where we are constantly monitoring and adjusting. But as much time as many folks, especially during the pandemic and now post-pandemic, I don't know how much time you guys spend picking up your phone and looking at social media, but a lot of people do. Those videos are so impactful when we can share them within the stream of things that are on social media. So we would love to be able to share them there, but also with lawmakers. Oftentimes when we're trying to, insert a video into an email to our network and let them know why a story is impactful, something like the DeMarco video, even when Abby Davis, that just joined us, shares her vlogs, those videos really help those issues resonate with people in a way that's different. So we would love to have it by video, but I am more than happy if you want to share your story just simply in an email, and we can go from there.
Okay, Allison, thank you. Allie asked, in our videos, you want them to say their name, where they're from, and then anything else specific. We can always edit those. So whatever they want to give us, we'll edit the video. Is that correct?
Yeah, your name, where you're from, and then whatever story you would like to share would be perfect. But we will circle back with you if there's something different that we want to work with. This is almost a homework assignment, as we've called it, just to kind of get a start with sharing your story with us. And then if there's a campaign or an issue we're working on specific to your story that we think that can make a tremendous impact, we'll come back to you and work on that.
Yeah, and that's I think, in getting to know the group over the next 3 events, it's also a great way for us to get to know you and your personal story as it relates to CVD and stroke affecting you or your family, or why you're here and why you're spending this time with us, which we're very, very grateful for. And we really try and plug volunteers into where we are working on these impactful and important issues. So thank you all very, very much for attending tonight. We look forward to working with you over the next 3 to 5 months and onward.
And as you heard from Representative Tenderholt, I mean, stories make all the difference. They change votes all of the time. I mean, the thing I'll leave you with is I was a part of a family visit to the state capitol where that family shared their personal story with a lawmaker, and they literally walked out after the vote, and this particular lawmaker said, "I just couldn't push the button no because I couldn't stop thinking about that family." And that is exactly what we want to resonate when it comes to sharing a story. So please share your stories. I promise I will work with you to make it a comfortable space where you can share that, but we want to hear from you and what issues impact you the most and what you care about the most. And we are very, very thankful for those.
I think we got one more question if we have time. Sure. After we send in our video, what should we expect for next steps between today and the next training? Good question.
So after you submit your video, you're going to hear from me. So that's the first thing, is we are going to have a great conversation about the video you submitted. And I will talk to you about any like current campaigns we have that we can use that on. And if not, we will ask to hold it and keep that kind of in our queue as we work towards Texas legislative session for early 2023, or any local campaigns that pop up between now and then. We will reach back out to you and ask if you are comfortable with us sharing that story again. So that's what you should expect between now and the next training regarding the stories you submitted.
All right. I think we are turning it over to Alec to wrap up.
Yeah, thank you, Elizabeth. Thank you, Allison, Abby, for showing us how to work your ring light and sharing the youth advocate perspective. And to all of our presenters and guests for joining us this evening. We hope you feel empowered and ready to share your own story with others in support of improving heart disease and stroke care for all Texans. Don't forget to make use of your ring light for our homework in the next 3 days as you share your own story. And we're looking forward to the next part of our HeartSpark series on April 22nd, when we'll talk more about the other important policy areas the American Heart Association is pursuing. If you have any questions, feel free to contact us and at the address listed in the agenda we sent out. And if not, we thank you and we hope you have a great night.
Thank you.
Thank you very much.
Thanks,
Bye,
guys.
thank you.
Thank you.
Thanks, everybody.
Okay, how did that go? Elizabeth, can you hear me?